Now, make the heading classification of drug route, classification of routes. Classification of routes. Routes of drug administration. Fine, no problem. Now, the classification is basically we are classifying the route of drug administration on the basis of bioavailability. Remember, we are dividing on the basis of bioavailability of the drug. Drugs. So now we have the idea. If we provide if we directly goes to the systemic circulation, it will provide the 100% bioavailability. Fine. And if we goes with the others like through our GIT route, it will you can say lessen the effect. It will overcome the effect of the drug or bioavailability. There is a less bioavailability through the GIT route. So there is a two main type. Okay, there is a two main type. The first and the second. Okay, but there is also a third part. Okay, that we'll discuss. But first you have to understand the first. The first classification is called as the enteral route. See, your confidence is not always, it depends upon your own choice. Yeah. So sometimes you are dependent about your confidence. You want to confident from another person's thoughts, another person's concern about yourself. So yeah, take the advice from everyone. Okay, you are not supposed to discard the you can say suggestions. You have to always welcome, please, the suggestion. But also, if the suggestion is not aligned with your thinking, with your perception, with your own goal, okay, with your own imagination, then you have to slowly discard those suggestions. Fine? But you have to always look for the positivity. If you see the positivity, your life gonna be totally in a positive way. But if you take the negative things, or negative, you can say, output from the other suggestion, it will diminish your life. So listen everyone, okay? Now, the responding part is our own choice. We will respond according to our own mood, our own choice. But listen to everyone, take the advice for everyone. Fine? And I have one advice. I know, and it's my weak point, that I have to work on my pronunciation. Okay, so maybe you guys feel it hard to understand my pronounced word, my English, or maybe the grammar. Okay, so I will try to improve it, and I'm improving. I'm trying to improve it. Okay, fine, no problem. So let's come. First one is the enteral route, and another one is called as the parental route. Okay, write it down. Parental route. And there are certain other routes which is simply called as the others route, other course. Other routes, fine. Now come to the enteral route. What does it mean by the enteral? Enteral denotes, something called as the gastroenterology. Enteral route means the route by which we are taking the medicine and which goes through the GIT. Okay, so whatever the drugs which goes through the GIT tract, that is called as the enteral route. Okay, so in the enteral route there is a 3 classification, further 3 routes. Okay, the one is you already aware, and that is called your oral route. Fine. Another one is called as the buccal route or some lingual route. Okay, and third one is called as the rectal route. So these are the 3 routes which come through the enteral route, means the drug which goes through the GIT. Got it? No problem? Okay, so write it down. So the first is, oral route. It is the most common route. It's the most common route. Oral route, fine. Another one is your, buccal or sublingual route. Sublingual route, fine. And the third route is the rectal route. I will explain each route, fine, but for a while just write it down. An rectal route. Got it? Now come to the parenteral route. Now in the parenteral route, it means you are directly providing the drugs, the medicine to the systemic circulation, means to inside the blood. Okay, you are directly, you can say, assessing the blood route. Because remember, blood is a medium. Blood is a medium by which the drug metabolites. See, drug is the macro particles, okay? And whenever it's got broken down into the small pieces, and that pieces is called as the metabolites. So there will be a primary metabolites, secondary metabolites of drug, okay? Metabolites. Now come here, parenteral route. This route means you are directly providing the drug in the blood, okay, in the bloodline. Now, in the bloodstream. So in the parenteral route, what route can come? Just list it down. Yeah, very good. It's one is called intravenous route, intramuscular route. Yeah, very good. Subcutaneous route. Okay, and intra-arterial route. Intra-arterial route. IM, IV, SR, IC. Fine? No problem? Now. And if we're talking about the other routes, okay, if we're talking about the other routes, then in other route there is a something called tropical route. Tropical route, okay? There is a vaginal route. Vaginal route. Fine. What else? Yeah. There is something called as the transnasal route. Transnasal route. Okay. And transdermal route. Transdermal route. And one more called as the intraosseous route. Write it down here. Intraosseous route, okay, and something called as the intrathecal route. Yeah, intrathecal route. Intrathecal route. Now discuss one route in detail. First revise it, okay? So it's easy to understand. Now we are discussing the classification of route administration. And we said that we basically classified the route of the drug administration on the basis of bioavailability of drug. Fine. So on the basis of bioavailability of the drugs, the route of drug administration is divided into the two types. The first one is called as the enteral route. Enteral route means those route in which the medicine will go through the GIT, gastrointestinal tract. Another one we define is the parenteral route, means we are directly providing the drugs into the bloodstream. Got it? And therefore there are other routes. Okay, other route is different from the enteral route as well as the parenteral route. And in the other route there will be a, you can say, the topical route, applying the ointment, lotion over the skin. Okay, there is the vaginal route, certain medication. This is a underexplored route. But it is a potential route. If you provide the medication to the vaginal route, it will also work optimally. Fine. Then there is an active route called as the transnasal route. Apart from that, there are the transdermal routes. In the transdermal routes, you are basically implanting some of the patches like the nicotine patches or some of the psychoactive drugs, some of the you can say anti-infertility drugs. got anti-fertility drugs, got it. Now there is something called intraosseous route. You are directly providing the drug into the bone cavities. Then there is a intrathecal route. You are providing the drugs, okay, in the, you can say, the meninges of the brain, okay, or in the spinal cord. Now there is a parental route. Parental route is the IM subcutaneous route as well as the intra-arterial route, okay. This is a classification. Now comes to the interior route. The first classification is the oral route. Oral route is the one of the commonest and easiest route in our body. Generally, it's a common observation. Generally, whenever we got sick first, and if our sickness is not turned into the emergency conditions, we are dependent on the oral route. But if there is an oral surgery, or if there is a problem in the swelling, okay, there is a dysphagia, on that moment you have to look for the alternate route, okay. It's the easiest route, fine. And generally the oral route taken medicines are, you can say, absorbed into where in the intestine, and there is a less bioavailability. So this is not you can say recommended in the emergency condition. This is not recommended in the emergency condition. And another thing about the oral route is that this is a cost effective, okay, and it's a painless. First of all, it's a painless, okay. It's not provide any pain, fine. But the only demerit about this oral route is that it's not provide the 100% bioavailability, okay. But generally whenever you got sick, you can use this oral route. And there are certain you can say medicines, like if we're taking the example of the insulin, okay. Insulin is a peptide hormone, so you cannot take this through the oral route. If you take this oral route, it will disintegrate, or okay, it will discard it into the GIT through our enzymes, okay. And so for that we need the alternative route. We need the alternative route. Got it? No problem. Now the second route is our buccal or sublingual route, okay. The another route is our buccal or sublingual route. In the buccal route, what is happening, there are certain medicine, okay, which is you have to put those medicine in your buccal cavity, okay, that buccal cavity. And it will bypass bypasses the first, you can say, pass effect or first metabolism. Remember, whenever I am talking the bypassing, it means there is a preservation of 100 bioavailability of the drug. These drugs will not, if you provide the drugs through the buccal cavity or through the sublingual route, those medicine will not go to the liver, okay. It bypasses the liver. It directly goes to the systemic circulation, means it directly goes to the blood stream, okay. So there is a buccal and sublingual route. In the sublingual route, you are putting the drug in the sublingual gland inside the beneath the tongue, basically, okay. Beneath the cheek, if you are putting the drug, this is called as the buccal route, fine. And if you are putting the drugs beneath the tongue, those type of medicine is called as the sublingual route, okay. Sublingual route medication, okay. The disadvantage is just that you are in the sublingual route, you have to only put, you have not allowed to, you can say, swallow those drugs, okay, or chew those drugs. You have to keep on that specific site, fine. So this is about the buccal as sublingual route. Then the another route is the rectal route, okay. So remember, the buccal route and sublingual route provide 100% bioavailability. Means what? It is bypassing the liver. It bypassing the first pass metabolism, okay, first pass metabolism, got it. And in the oral route, there is a less bioavailability, got it, no problem. Now coming to the rectal route. Rectal route is generally we use when there is a problem in the oral route, or if the patient is unconscious. Got it? And if there is a problem in the swelling of the, we consider drug, fine. Or if there will be excessive vomiting and nausea, Fine. If a patient have the excessive nausea and vomiting, and you are putting the drug, you are choosing if your preference of the choice of drug administration is through the buccal cavity or through the oral route, then the medicine will come out through the vomiting. Fine. So for on that type, if there is maybe a recurrent episode of vomiting and nausea, then you have to go with the rectal route. Okay, rectal route. And also, not all the medicines are tasty. Isn't it? Generally, medicines are not tasty, but there are certain flavors which is mixed in the medicines to make them, you can say, a palatable. Okay, palatable. So unpalatable drugs, fine, or those drugs which are, you can say, irritating, which are not good, okay, in taste. So those medications we are providing through the rectal route. And one of the, you can say, known example is the enema or suppositories. Okay, enema and suppositories are, you can say, put it through the rectal route. And rectal route also is you can say, it's have, the rectal mucosa is highly vascularized. Okay, the blood flow is very optimum in the rectal route. Fine. So partially it also bypasses the liver. It's not fully bypasses the liver, but partially it's also bypassing the liver. Fine, no problem, understood. Now, coming to the parental route. Now, in the parental route, the first one is the IV, okay? In the parental route, is it visible? Now, in the parental route, the first line is the IV. IV means intravenous, okay? Generally, we choose the IV intravenous route in the, that the veins are present in our upper extremity as well as the lower extremity. But our preference is generally in the upper extremities. Okay, why? Yeah, very good. In the upper extremity, if we choose the, you can say, the drug administration, the route of drug administration in our upper extremities, it will overcome the chances of having the thrombocytopenia or the thrombophlebitis, not thrombocytopenia, pardon. It is called as the thrombophlebitis. Now, thrombophlebitis means inflammation of the vein, and thrombus means there will be a, you can say, a mass formation. Okay, there will be a clotting. Okay, there will be a clotting. So there is something called thrombophlebitis. If you choose the lower extremities, then there is a higher chances to having this thrombophlebitis. Okay, thrombocytopenia means low platelets count. Okay, then that is not applied here. Okay, so generally in the IV we are choosing the upper extremity, and generally the cephalic vein which is present in our, you can say, hand, cephalic vein. Apart from that, we are also choosing the brachial vein. Okay, and these are present in superficial portion of our body, so it is easily accessible, and this provide also the 100% bioavailability. If we're talking about the contraindication of the IV lights, it generally causes the mild pain. Okay, there is a redness in those area, and occasionally it's called the thrombophlebitis. Now, if suppose the patient's hand is got injured, okay, the patient's hand is injured, on that very moment we are choosing the lower extremities, and in the lower extremities we are basically choosing the dorsal venous plexus which is present in our foot. A vein, dorsal venous plexus which is present in our vein, we are choosing this route. Got it? No problem. Now, coming to the IM, intramuscular injection. Basically, intramuscular medications we provided on our certain muscles like deltoid muscle, dorsal gluteal muscle, fine, dorsal lateralis muscle, femoris muscle. Okay, so and rectus femoris muscle. So these are certain sites of providing the intramuscular, you can say, the injection. Okay, and generally we providing the vaccine through the IM. Okay, through the IM. So whenever we need, you can say, the slow absorption or slow action of the drug, we are choosing the IM line. We are choosing the IM route. Fine. Apart from that, there is a subcutaneous route. Through the subcutaneous route, okay, it's have the first thing is our subcutaneous tissue have the low blood vessel. Okay, And through this low blood vessels, whenever we inject the drug into the subcutaneous injection, there is a slow and sustained rate of, you can say, the drug flow. Fine. And the insulin, generally we need insulin in a constant and sustained way. Fine. So generally we are putting the insulin through the this subcutaneous route. Now coming to the intra-arterial route. Intra-arterial route is generally you can say chosen for like angiography. Okay, for understanding and the drug, you can say the blood vessel histology, we are choosing the intra-arterial route. We are choosing the intra-arterial route. Fine. So this is for angiography, and also for certain you can say central nervous diseases, we are choosing the intra-arterial route. Now this is all about the classification of drug, indication and contraindication. Now let's come and discuss that what are the rights. Okay, what are the rights of drug administration? Till now you understood? Yeah, no problem. If you have any queries, you can comment down about related with anything related like the writing, or if related with the pronunciation, or if there will be a problem in the sound or video quality, you can comment down. It's our initial phase, and we will rectify it as soon as we can. Fine, no problem. Do this. Like the detail. Now make the heading right of drug administration.
It starts.
Rights of drug administration. The cut. Oh. Generally, the administration of medicine is a practical aspect. Okay, in a medical science, it's a practical aspect, but you have to also understand the theoretical part. Okay, so that in your mind there is already, you can say, the pre-idea about what can be the indication or contraindication of a particular drug. Fine, no problem. So then, what are the rights? Okay, the first right is the right drug. Right drug. Okay. Another is, I will choose the multiple color. Right drug. Okay. Right patient. Right patient. Okay. Then another is right dose. Right dose. Now, one of the important or crucial aspect is right time. Right time. Okay. And the another thing is right drug, right patient, right dose, right time. Yeah. Right quantity. Or you can say right quantity. Okay, and there are certain other rights. Yeah, right side, which we discussed. Right side. Side. Now, talking about the right drug, you know, if we not provide the right drug to the patients, then what will happen? Patients can lose their life. Okay, so it can be a fatal also. Fine. So we have to always providing the right drug to the patient. Another one is the right patient. You have to identify the patient. In the hospital setting, there is a multiple, you can say, patients are there. So you have to identify the right patients. Okay. Now another one is the right dose. Dose matters. Yeah, dose matters a lot. Okay. You know, like the same drug can be a life-saving and it can be turned into the poison. It depends upon only the dose. Okay, so you have to also take care about the dose whenever you are administering the medication. Then the time. There are certain drugs which we have to only they are specific to us providing in the night, in the morning, in the empty stomach. Okay, fine. So the timing matters. And then there's the right quantity. Okay. Right quantity, okay, and right site. Okay, you are not supposed to provide the IM injection in the IV. Are you getting my points? Yeah. So the site is also important. So these are the rights of drug administration. So for concluding today's lecture, basically we discussed about the route of drug administration. Fine. We said that the route of drug administration is the site where we are providing the medication or through which or via which we are providing the medicine or drug. We also seen that this route of drug administration is basically classified on the availability of the bioavailability of the drug. Fine. Whenever we taking the medicine, it undergo the metabolic changes. Okay. And after the metabolic changes, whatever effect of drug is present, that is called as the bioavailability of the drug. We classified the route of drug administration into the two types. The one is called as the enteral route, another one is called as the parenteral route. Now in the enteral route, through the GIT, there is a first route is the oral route, then buccal or sublingual route, and another one is the rectal route. Apart from that, we have the parenteral route. In the parenteral route, it directly assesses the blood stream. Okay, the drug metabolite directly goes to the blood stream and thereby providing the 100% bioavailability. Okay, and there is the intravenous, intramuscular, subcutaneous, and intra-arterial. Then apart from these parenteral and enteral route, there are something called as the other routes. In other routes, we can provide the medicine in the spinal cord, intrathecal route. We can directly provide the medicine in the bone cavity, intraosseous route. We can directly apply the drug over the skin, called as the topical route. Okay, we can also provide the drugs through the nasal cavity, called as the you can say transnasal route. Fine. So, and we also seen about the each route's significance, that's the indication, contraindication. Okay, and at last we discussed about the rights of drug administration. Got it? Now in our upcoming lecture we will discuss about the the fundamental two aspects of pharmacology, called as the pharmacodynamics and pharmacokinetics. Okay, basically we will have the detailed discussion over how drug is metabolized in our body. Got it? No problem. So thank you for having me. Bye. Have a nice day.
And I'm going to